Hi everybody, this is Mike Tallon, and I'm here with another video. I'm going to be making two today on the treatment of hereditary hemochromatosis, the disease that is at the heart of a book that I've recently written, Incompatible with Life, a memoir of grave illness, great love, and survival. And if you've been watching this series of videos, you know that you can read the introduction to that book at my website, michaeljtallon.com. Or actually, I think since it's backwards, it would be michaeljtallon.com, but you'll figure it out. And if you could, I'd love it if you could read that introduction and leave a comment. I'm trying to get the thing published, and that would help. Also, join my mailing list. The treatment of hereditary hemochromatosis. Where to start? Well, first, current technology does not allow us to get rid of hereditary hemochromatosis. It's a genetic condition. There is some hope, and there's some great work being done in the field of CRISPR technology, gene replacement therapy technology, that promises that in the next 10 years or so, it may be possible to do gene replacement for those of us who have hemochromatosis that would simply end the problem once and for all. Wouldn't get rid of the damage already done, but it would prevent further damage. We're not quite there yet. I'll make another video on CRISPR technology in the future. So currently, the treatment for hereditary hemochromatosis is, in fact, the oldest medical intervention in the history of the world. And again, second video, we'll talk about how that came to be. But it's bloodletting, also known as phlebotomy, or more artfully as vein venting. It is the removal of blood from the body, the balancing of humors. The way that it works is, as we've covered in previous videos, hemochromatosis causes the body to be unable to eliminate dietary iron. So when you eat a steak, when you drink a pint of Guinness, when you have some spinach, if you're a hemochromatite, the iron that's in that food gets stuck in your body. Now, everyone needs iron, a little tiny bit, a couple of grams in their body distributed in the red blood cells and in the bone marrow and the spleen for the replication of new red blood cells when the old ones die. The iron atom is kind of the central architectural point of a red blood cell. It's what the oxygen that comes in through your respiration adheres to and is then circulated to your cells. So it's crucial for the oxygenation of your body. And actually, this will make sense if you think about it. You know what happens to iron that's left out in an oxygen-rich environment. It rusts, or steel. And it rusts because iron and oxygen are chemical sweethearts. They love kissing one another. And so that's all well and good. If you have a system, a normal system, where you have a steak and you drink your Guinness, your body takes the iron it needs and it squirts the rest of it out the other end, and all's good. Bob's your uncle, as they say in England. But if you're a hemochromatite, those iron atoms, they take a wrong turn in Albuquerque, and they get stuck in you. They get stuck in your liver and your pancreas and your heart and your glands and your joints. And so the way that iron can be removed over time, since you can't go in and squeeze the liver to try and remove the iron atoms, is you begin to slowly remove blood from the system. Or for those of us who've been very, very, very sick with hemochromatosis and the diseases associated with it, not so slowly. So basically what it is, if phlebotomy, bloodletting, it's the same thing as they do at the Red Cross. Stick a needle in your arm, and they drain out about 500 milliliters of blood. The way that this works for a hemochromatite is that you remove 500 milliliters of iron-rich, very iron-rich blood from the body, but you are preventing the person, you have changed the diet of the hemochromatite so they're not ingesting new iron. When your body then makes new blood cells at the end of a 120-day life cycle for a red blood cell, it needs to get the iron. And so if it's not coming in through your diet, it will first go to your bloodstream, it'll then go to your spleen, it'll then go to your bone marrow to get that iron. And over a long period of time, if you continue to do that repeatedly, far more often than people just donate blood to be good human beings, then they can remove the iron-rich blood and then force the body to find the iron atoms that it stored over the decades, because it couldn't get rid of it any other way. And so over the course of many, many months or many, many years, someone who has a high iron overload can slowly reduce their iron toxication in their organs. And by doing so, they can prevent, hopefully, future damage to those organ systems. Sadly, it doesn't repair the damage that's already been done, but that's essentially the treatment protocol. When I was in the hospital, my ferritin levels were sky high. My iron levels were sky high. You're supposed to have, I think it's between, 50 and 200 blah blah blops per blah blah blop of iron in your system. Mine were between 7 and 10,000. And they had toxified my body so badly that I was incompatible with life. Visit my website at michaeljtallon.com and read that introduction. But I had so much iron in my system that in 1 week, actually in 4 days, I went through 5, or was it 6, different bloodlettings. They removed 40% of the blood from my body. It was a hallucinatory and wild experience. Maybe I'll make another video about that soon. And then when I was released from the hospital, I donated blood. I had a phlebotomy over 100 times in a year, twice a week for an entire year. I was pretty tired that year. But that's essentially how it's done. I'll make another video in a couple of minutes about the history of it, because that's a fascinating story too. But I just find that I think it's a pretty remarkable thing. This disease that was, that I got from a Neanderthal ancestor. Watch the previous videos, you'll learn about that. 40,000 years ago, is treated by a medical practice that was, designed in ancient Greece. Again, look for the next video to get that. Until then, that's how you do it. That's the treatment. If you have hemochromatosis or you suspect you might, talk to your doctor and get some tests done. And there is a protocol to try and at least stop the damage if you have it. So thank you for watching, and love to you all.